Hi, I'm Dr. David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain providers and clinics around the state. Today the topic is a very exciting one, and that is platelet rich plasma, otherwise known as PRP therapy for short, for the use in tendinitis around the elbow. Okay? Tendinitis around the elbow, which is known as epicondylitis, can be a very difficult problem for patients. And that's tennis elbow is the layman's term over here, and then the medial side is golfer's elbow. What can happen is initially you have inflammation and pain, and that's tendinitis. But over time, it can turn into what's called tendinosis, because the inflammation really starts to go away, and you just end up with bad tendon degeneration and pain. Okay? So a new study came out of southern Florida, and it looked at over 30 patients who had either medial or lateral epicondylitis. So they looked at both, okay? And it was men and women, a huge age range, and all of them had failed at least 6 months of conservative treatment. So that's a while, right? These people had steroid injections, they had anti-inflammatory medications by mouth, they had physical therapy, they had tried a broad range of things, didn't work, okay? So what would they supposed to do? I mean, the next phase would be surgery, right? So PRP therapy represents an excellent chance at regeneration of that tissue that has been inflamed and degenerated. Okay? So they did one injection of 3 cc's of PRP. What is PRP? Well, it's pretty simple in concept, actually. It's your own blood, so they take it from just a blood draw, okay? Goes into test tubes, and in the office it gets spun down very fast in what's called a centrifuge machine, and for about 6 minutes. And then what comes out is a test tube has 3 layers in it, and the top layer is what's used, and that has platelets in it, growth factors, a lot of good stuff. And when it gets injected in the body, it's very good at calling in stem cells, your own stem cells. Okay, it's got some stem cells already in your blood, but it calls in a lot. And they've shown that in studies actually with cows, injecting into their knees. They showed increased cartilage formation and increased stem cell numbers that came into the joint. All right, so what did they look at? They looked at VAS scores, which is the pain level, you know, you say 0 to 10. They looked at functional capabilities with doing recreational activities, housework, gardening, sports, things like that. What they showed is that only 2 out of the 30-some patients ended up going on to need surgery. And that was in 2 high-level athletes who tried this treatment for a month and then said, you know, it's not getting better enough, so I'm going to go ahead and go for surgery. The other about 30 patients didn't need surgery, and they didn't need further treatment, actually. The few patients who dropped out of the study, they ended up speaking to all of those, and all of them said, I got better, I didn't need any further treatment, I just didn't feel like coming back in, okay? You know, a lot of times patients who fall out of studies end up doing poorly. They don't want to come back in because they're upset. Not in this case, okay? And statistically, they showed that patients did get less pain, increased function, and didn't go into surgery. So PRP has a lot of promise behind it, and studies like this just back that up. So PRP is being offered at pain clinics in Florida. We have 7 clinics in our network right now, National Pain Institute, that do offer the treatment, and others are bringing it on board, okay? So check our directory at floridapainnetwork.com. Just click on I Need a Pain Doctor, put in your zip code, and it'll show you the ones closest to you. If you have any questions or one doesn't show up close to you, give us a call. You can either email us or call us at 877-877-8556. I'm Dr. David Greene, CEO of the Florida Pain Network. Your pain stops here.